Hello, everyone. Thank you so much for being here. On behalf of the Environmental Finance Center Network, welcome to today's webinar, Tips for Retaining a Happy, Healthy Wastewater Workforce. My name is Zoe Eisel from the Syracuse University Environmental Finance Center. Before we begin, we're going to go over a few logistics, and then we can get started. During the webinar today, everyone will be kept on mute to ensure audio quality. If you have a question, please type it into the GoToWebinar question box anytime throughout the session. We will be answering some questions throughout the session and saving some questions for a facilitated Q&A session at the end of the presentation. Please note, GoToWebinar has recently gone through an update, and you can now add live captions or react using emojis. After the webinar, you will receive a follow-up email that includes a link to the recording and any other information you may need. You can also download the slides from today in the Materials tab in your GoToWebinar control panel. This webinar has not been submitted for pre-approval of continuing education credits, but eligible attendees will receive a certificate of attendance for their personal record. To receive a certificate for the session, you must attend for the entire session and register and attend individually using your real name and unique email address. Certificates will be sent via email within 30 days of the webinar date. If you have any questions or need assistance, please contact smallsystems@syr.edu. Now for a little bit about us. The Environmental Finance Center Network provides training and technical assistance to small water and wastewater systems in all U.S. states and territories through our building technical, managerial, and finance capacity programs. If your community or utility needs assistance with drinking water or wastewater system management, please feel free to contact us through our request form, which I will be sharing shortly in the chat. Our team is located across the country and can readily deploy staff or resources to meet your community where you are. Each of our partners brings unique experience and specialized expertise to address a wide range of community needs and expand the available services EFCN can offer. Through this network, EFCN works directly with communities and utilities to provide a wide variety of free, customized technical assistance services. Find only some of the ways our team can help support your community listed here, and use the link in the chat to submit a request and receive tailored support based on your needs. Lastly, make sure to keep up with EFCN by scanning the QR codes provided or visiting the links I will be sharing shortly in the chat. Through these links, you can view upcoming webinars and trainings, sign up to receive notifications for future events, and access the recordings of webinars you may have missed. And on that note, we can get started. I would like to introduce our presenters for today, Brian Bohnsack, PhD, Program Manager at Wichita State University Environmental Finance Center, and Nancy Spangler, PhD, President at Spangler Associates Incorporated. Welcome, Brian and Nancy, and I will go ahead and hand it over to you.
Thank you, Zoe. Nancy and I are excited for you guys to present to you guys today. Here we go. Nancy, if you want to say something, I'm going to start sharing my screen. So
that's great. Good morning, everyone, and thank you for having us. I'm very pleased to be here with you today. Thank you, Brian, for inviting me.
And you guys are seeing my emails. Hopefully you're seeing. Is it switched over to the PowerPoint? Are you seeing it now?
Yeah, it's just not in presentation mode quite yet.
Okay, all right. Sorry about that. It worked earlier, but there we go. Is that working now?
Yep.
Good
That's
deal.
Great.
All right. Hey, whoops, darn it. Thanks you all for showing up. Sorry about the technical stuff on my end. Nancy and I are excited to meet with you all today. A little bit about me, just briefly. There we go. Let me go down. I'm a program manager here at Wichita State. I've been here for 8 years. My specialty is working with water utility boards and councils. Why is it not? And I've had a long career with federal and state natural resource agencies. Nancy, I'll get this working at some point. If you want to introduce yourself, Nancy. So
the slides aren't advancing, Brian.
Okay. Oops. Are they advancing now?
No.
All right. Cancel. Sorry. Still no?
No, still on the first page.
All right. Sorry.
Usually you can just push the little down button.
Darn it. I'm not sure what's happened. Tanya, you want to help me?
Practicing. It was working earlier. Zoe, can you advance them from your end?
I can download them and look into advancing them, but not at this very second. I'll start working on that now.
What are you seeing on your end, Nancy?
Just the first slide.
Man, it's like my screen's
How
locked
were
up.
you advancing them before?
Yeah, well, I was in PowerPoint and I can't get out of this. So, oh my goodness. Huh, my screen is locked up.
Okay, and you know what? I have them as well. Let me see if I can.
I apologize for those. So, Nancy, a little bit of background about this and how this all came about. And my screen is locked. I don't know why. Nancy and I are actually related. Nancy is a distant cousin of mine, and we got. Sorry about this headache, but Nancy and I met at one of my family reunions. I'm the last Bohnsack standing in Kansas with the Bohnsack surname, and Nancy was there, and we got to talking. And she's a mental health professional, and one of the things that struck me is that one of her clientele is the pipe fitters union, and that just really resonated with me, and because that is it's a rough and tumble male dominated profession, and here Nancy is with years of working within that clientele. And so at that particular family reunion, we ended up having a great conversation with another relative that works in the construction field. That was 2 years ago. And then last year, Nancy and I continued kind of with our discussions and learn more about her expertise and how she's applying it, particularly with some of the brain development stuff. So,
and with that, Brian, I have the slides up. Zoe, if you can allow me to share, I can pull them up.
Cool.
I also have them up.
Okay.
If
Great.
you'd like.
My screen is locked up, and
There we go. We're all good.
If you guys will just tell me next slide, I'll be able to move them for you.
Okay. Brian, are you ready for me to talk about my background?
Yep.
Okay, next slide, please. So I began in healthcare. I was an occupational therapist. I covered all the different areas, peds, rehab, psychiatry, and especially pain and stress management really intrigued me. I moved to workplace health promotion with the idea that, wow, we could prevent a lot of these things from happening, and worked for many years in that area, but always kept the stress part in my toolbox. I began to go into organizations and employers, and I noticed from the very moment I walked in the door, I could get this sense by the way they invited me in, the people that they invited to that first initial meeting to talk about well-being, whether or not things were going to go well there in terms of launching a wellness program. And I started to get really intrigued with that and to study that aspect of leadership and management and workplace culture and how that affected people's stress. I had a great opportunity to work with the American Psychiatric Association in Washington and to work with employers who were addressing mental health from an organizational viewpoint. I ended up interviewing a lot of those people and others in some of the country's largest employer work base. And I noticed that some of the things that they did were very much in common. So I'll explain a little bit more about that. But the influence of leaders and managers just can't be overstated. And I noticed in our attendance list today, a number of you are leaders and managers. So I hope you take this to heart. because of my OT background, I always was kind of a brain research geek and always was reading the science. So I have applied it to this idea of individual and organizational well-being. My mission has become to help build healthy and high-performing, so in other words, effective, financially solvent individuals and organizations through a shared responsibility for resilience. Next slide, please. And if you all have questions, please type them in, and Zoe will be monitoring those for us. And Zoe, feel free to interrupt us if there's a question that you think is timely for the topic, or save them to the end and we can answer them then. So Brian, you got this slide from the Center for Workplace Mental Health, which I helped the American Psychiatric Association begin many years ago, before really workplaces were talking about mental health. So it was really great to be involved with them. And this, I assume, is a description of the water industry.
Right. A lot of things resonated with me, and particularly, as we were talking before the webinar started, you know, the folks out in the water distribution side, the folks that are responding to the water line breaks, you know, they're out there. It's a very physical and demanding profession. Can be, you know, chronic injuries. That's one of the things that struck me on this. And also their time, you know, they don't control their time in a lot of instances. The folks that are responding when a water line breaks, you know, it's immediate. You know, we always joke internally that the water lines are always going to break, you know, on Christmas Eve when it's 20 below zero and things are out of control. These folks are kind of like first responders, and they're going to go out there and they're going to fix the issues. So yeah, a lot of similarities. This particular slide shows from the construction side, but to me, it's so much similarities with the water workforce.
Very simple. A lot of physical activity, a lot of tough, long hours, separation from family and friends. And as we talk about resilience, we'll talk about how those things really contribute to stress and that urgent, immediate response. We'll talk more about that. I wanted to mention that I've worked with a wide variety of employers, a lot of different kinds of industries, but right now I'm really focused on physicians at the University of Kansas Medical Center and construction, particularly leaders and managers, and now engineers. Every organization has a unique culture, but all of those have some commonalities in terms of these long hours, kind of being tough and needing to commit yourself to something. So think about that, everyone, as you think about the work that you do and how this applies to your own life and the life of the people you care for.
And Nancy, the one thing I'm hoping to, you know, folks out there, sorry, I'm scattered because my screen is still locked. I hope you guys will take advantage of some of the resources between Nancy's expertise and some of the resources. In my career now here at the EFC, I've been exposed to a lot of places, a lot of single person shops, small communities that don't have may not have access to good EAP programs. Nancy's an excellent resource, and so that's what I'm hoping you guys will get out of this webinar. So thank you very much. Nancy, Zoe, I think go on.
Next slide, yeah. So mental health is a broad continuum. When we look at mental health disorders, there are criteria. You have to have certain symptoms in order to be declared a certain diagnosis in mental health language. And that's because a caregiver has to be reimbursed somehow, and they have to give specific data for a diagnosis. But all of us have had symptoms that could be related to a mental health disorder. Everybody's experienced a little bit of anxiety. Everybody's had down moments. Everyone has had weird, wild thoughts. But that doesn't mean that we necessarily have a mental health disorder diagnosis. But it's a broad spectrum. It affects how we think, how we feel, how we act. And it's very important for us to realize that we have a lot of control over how this mental health or mental illness develops. We have more control than we realize when we start early. So, next slide, please. So, mental health is really essential to our productivity. Obviously, physical health is as well, but mental health really contributes. They go hand in hand. And your work can be high stress. You are responding urgently, immediately, and it can be physically demanding. We hope that by raising awareness and by talking about mental health, that it reduces the stigma. I've seen this over and over and over again in organizations. When we start to talk about mental health, people volunteer situations that they've either run into personally or with a family member, a friend, or a coworker. So just giving an opportunity to talk about mental health, it reduces the idea that people with mental illness are just weirdos. That's not the case. We all have mental health issues. It's just a matter of how it comes out and when. So early support and connectivity, helping people feel okay, is really important. Brian, this is where you thought we might mention that, there is this responsibility to address when someone is unsafe on a work site, either because of substance abuse or perhaps psychosis. If someone recognizes that someone is in crisis, there's the OSHA reasonable suspicion legislation, and you really do need to get someone off of a work site if they are causing a safety problem. However, my point is we can begin much earlier. Usually someone doesn't go into crisis mode automatically. It builds up. And there is also legislation, the Americans with Disabilities Act, that gives every worker the opportunity to come forth and say, I am struggling with this condition, and I would like to work on this together so that I can get accommodations. Employers are required to provide accommodations when it's possible, and to work together with that person to allow them the opportunity to stay in the workplace and to be effective. And in many cases, that can happen.
Zoe, if you want to advance the couple of slides, yeah. Thank you for Nancy. You're carrying this. Thank you. My screen still is still stuck. So, hopefully the slide is the one that I see on campus a lot. Obviously, I'm at a university, and this is one of the things we have that mental health is very important at the university level. So hopefully it's the slide that says it's okay to not be okay, and that kind of gets back to what Nancy was talking about just a couple minutes ago or a minute ago. We all have bad days, good days, bad days, and that's fine. But the thing is to catch it early. And then the other thing I just quickly wanted to share on this particular slide was, it's time to talk about it. It seems like it's time to talk about it. And Nancy, you're doing a great job. Thank you. I was going to share, even the timing is right, seems to be right. I was going to share with everybody that my wife and I are big Taylor Sheridan fans. And if you're watching the Madison, the latest Taylor Sheridan spinoff, he even briefly touches it in that with Michelle Pfeiffer, at least so far what we've seen. So the next slide, if you would, go on and advance it, Zoe. And this gets, I think, to what you were just talking about, Nancy. And it's one of the things I wanted to share with you guys, and you just actually covered it. Hopefully you're seeing, and I apologize, but hopefully you're seeing the slide with common issues in the workplace. And Nancy, you've already addressed it a lot, but I wanted to share something with you all from my career. And I said, Nancy, we've covered it. I had a coworker that was a very good friend of mine. She was actually my go-to person that I used to get stuff done. She knew how to get stuff done. So really, really trusted her. She started showing up to work drunk. And Nancy, I think what we tried to do was to hide her from the supervisors because we didn't want her fired. She was a single parent struggling. I found out later that her condo was about to get foreclosed. So Nancy, instead of hiding, and trying to hide this person from the supervisors until she sobered up a little bit. What could or should I have done?
Yeah, well, it is really hard when someone is struggling with substance abuse to help them see that there are alternatives. Addictions are so grabbing. I mean, that's why they're addictions. They go to a certain part of your brain and they drive you to do things. So it is hard, but I would be curious to know how it turned out. It is possible to get people to make a commitment to change, but it takes a kind of a cavalcade of events for them to actually see that there is possibility, that change is possible, that there's someone there who cares about them and will work with them, and that the outcome is much better than the alternative.
Right. And Nancy, from my perspective, you talked about, I wasn't aware of the OSHA part, and I wasn't quite aware of what you talked about with the AD, Americans with Disabilities Act. What I found surprising here was I kind of had a similar discussion with my stepdaughter, my stepkids here, and they actually work in the Wichita school system. And it kind of goes back to a little bit of what you mentioned, that kind of like the employee has rights. And what I've found, and I think, Nancy, it's consistent with what you're talking about. If a person has substance abuse or is having any of these issues, I was surprised to find out, like, if a person was showing up drunk at work, the supervisor approaches them, and if they deny it, that they're drunk, and then found that, or other issues, that, then the supervisor can potentially start to work on the termination process. But it goes back to just what you were talking about. If the employee says, you're right, and I have issues, then it takes you get an entirely different route. In my case, the person, I think, did go get some alcohol tested.
Okay.
So, but yeah, like, in different routes, and it's kind of like, we need to know that we have rights, and supervisors, it's not an automatic firing and so forth. So.
And I think also that there is hope. Sometimes when people get into situations like that, where the money is bad and things are just piling up, you think there's not a way out. By supporting people emotionally and by standing by them, you can really change outcomes. It just happens a lot. But it's hard work, and we're not used to doing that. We're kind of used to going, ooh, that person's having problems, I'm going to stay away from them. That's more the typical reaction.
Yep. Zoe, go on in advance if you would. So Nancy, if you want to talk for some of the signs to look for, if you're a supervisor and or look things that you can look for in your coworkers, what are some of the warnings?
Yeah. So talking about wanting to die, feeling hopeless, feeling like there's just nothing to look forward to. Withdrawing is probably the most frequent, either withdrawing or having dramatic, expressive mood changes where they're saying things that they wouldn't ordinarily. The giving away of possessions, saying goodbye in a happy mood. I mean, sometimes you see a person who just seems like, wow, they've really come out of it. But then they say something that you're like, why did they say that? Because they've made this commitment to themselves to end it all, and they feel good about it finally. So those are things to look for. Increased substance abuse, which often contributes to just a disheveledness, an odd odor, showing up late or not at all, or just not being themselves, not finishing projects, not meeting deadlines. So those are some very common things to look for. And then things we can do, the next slide, are just be open. When you see something, say something. Learning the skill set of communication when it's a difficult conversation is one of the most important skill sets you can practice in life. You can apply it in so many different ways. If you are a person who tends to not bring things up that are uncomfortable, I really challenge you and encourage you to try some new skill sets. You may save someone's life. Education and awareness building for employees and leadership around the mental health topics and the crisis that we're in are extremely important. Offering peer support and check-ins, and using respectful, non-judgmental language. So my business partner and I have developed a peer support program that we have done with the pipe fitters and now a couple of construction companies. Actually, we've done it with a number of construction companies in different ways. Some of them have done day-long trainings, multiple day trainings. Others have gone more a peer connector route and just do a 2-hour training to learn some of these ways of challenging your communication skills and then looking at things to look for and then practicing some of these scenarios with your peers. Like, how would you handle this? What are people that we might want to check in on? And just reaching out to people to be sure that they're okay. I wanted to talk about this respectful and non-judgmental language just a minute, because if the water industry is like construction, there's a lot of humor. You're standing around sometimes waiting, and the culture is, and I grew up in the construction culture. My dad owned a construction company in Lawrence, Kansas, and I would go to coffee with him, early mornings before he set his teams out on their assignments. And there was just a lot of joviality and joking and fun stuff until he was like, get going, let's go. And, firing them up and shocking them into action. And I also noticed sometimes there was joking at someone else's expense. And that translated into our family as well. I mean, we have a lot of fun with each other, but sometimes, somebody is a little embarrassed. Well, if somebody is already on the verge of feeling depression or feeling anxiety, being the constant butt of a joke is not healthy for them. And we don't really think about it much until that person is really struggling. So I just wanted to point that out. Think about it when you're having fun joking with somebody. Is it respectful?
Yeah, that I was worried about that too, Nancy. It's a very rough and tumble. Career from my experience, just out and about with the water operators, and like you said, and if nothing else, call them out the other way. Come on, you're not that bad. You get them in the truck and you're riding in between work,
Right.
and it's like, yo, come on, you'll make it. You'll make
Tough
it.
it out.
Yeah, suck it up. You'll be fine. And so just pay attention to your gut feeling and try to be empathetic. So
yeah. We'll circle back to the gut feeling here in just a second.
Yeah. So I think you can go on.
So the next part is supporting your workforce. Employee assistance programs are in just about every large employer has an employee assistance program. A number of mid-sized employers do too. Small employers, not so much. But nobody knows about them. They are free counseling. In some cases, it may be 3 free sessions. In other cases, it's unlimited sessions. And for all family members, it's like the best hidden mystery of all time. And the people are extremely accessible and well-trained. So if this is a new concept to you, EAPs, I encourage you to look at your benefits website. It may be called something else. It may be a funny name. But if there's a website, check into it. If it says we support your well-being, that may have a broad umbrella, and mental health may well be a part of it. And then the other things, Brian, I don't know if you wanted to mention anything about those specifically.
Yeah, just like you said, just be aware that there's a lot of different resources out there, and in particular, some of these ending slides. Like I said, Nancy's an expert in this. You can get on her website and see some of her partners. I've just been surprised and disappointed somewhat with surprised with a lot of the small rural water operators, the small community operators, and in so many instances from my experience, it's a one-man shop within the water utility. You've got a city clerk that's probably doing 2 or 3 different jobs. So they just don't have the HR departments out there. And so what I'm hoping that as a result of this webinar is that some of y'all will be able to see some of the free resources out there and access them if and when you need it. There's some neat stuff out there. Like Nancy already kind of mentioned it. Most of the big agencies have EAP programs, and that's why I put that on my cover slide or whatever. I've worked for state and federal agencies, so throughout my career, I've been lucky to have EAP programs, but not everyone's so lucky. So that's why Nancy, I'm just so glad you're sharing this stuff, and later on we got some free resources for you.
Well, yeah, and also, I didn't put this on our slide for the resources, but check your county resources. If you're in a rural area, your county health resources may be a go-to. Your state might have mental health resources that you don't know about. Even your community could have nonprofits that provide services. For example, if someone's going through a financial crisis and suddenly they're homeless, there are resources in many communities that could help that person through that crisis and maintain some sense of mental connectedness, and before they go into a full-blown mental crisis.
Yeah. Thank you for sharing that. And yeah, it's hit home nearby with me, and the lack of folks knowing about it. My sister and her daughters are farmers, married into farming families, and about the time of our first family reunion, it was hitting my niece hard because one of their good friends is a farmer, probably obviously doesn't have an EAP program. One of their good friends had committed suicide, and so there's resources out there. Thank you for sharing, Nancy, because that's what the whole purpose of this kind of discussion is. So
yeah.
Zoe, next slide, Zoe.
So I've done a lot of training in stress management, mindful resilience, skill building. There are so many things that we can do to change our brain. And I will mention some more things about that specifically in just a minute. But I just want to say that all of these areas interact together. That mindful resilience building, physical activity, and healthy habit development. There are just ways that we can develop skill sets that reinforce one another. Fostering teamwork and social support. Social connectedness is one of the greatest reducers of health risks of all kinds. You just don't want to be alone. We're not built to be alone. We are creatures that connect. And however that works for you, build it up. And then recognizing when people are doing things well. One of the greatest things that I've seen in terms of helping companies develop positive approaches towards mental well-being is looking at the values that they have as an organization and then rewarding when somebody lives out that value. It develops a direct brain pathway of decision making that follows the mindset of the intentions of the company. And by acknowledging and being specific about what it was that employee did that contributed to, living the values of the organization, it makes it more likely that somebody else is going to do that very action the next time it's their chance to do it. So.
Yep. So
I'm gonna interrupt briefly with a question that just came in.
Mm-hmm.
The question is, how or what is a good way to let your water operators know you are available if they are having mental or stressful issues? This is hard when the operators are tending to show the tough guy attitude.
Well, some ways are, how do you communicate in general? Use those tools to communicate regularly the things that are available to them, like counseling, or like if you just are available to talk through things, you're just saying that. If you are having struggles, be sure that you reach out to me. I'm available these hours. Here's my phone number. But the more you communicate through the regular channels that business communicates to people, the more it becomes more accepted, less stigmatized, and just more regular in the conversation. Brian, any other thoughts on that?
Yeah, I was just thinking, maybe on the practical side, yeah, you're not going to want to necessarily do it in I don't know if you'd want to do it in front of folks. I mean, you could do it in front of a crew and say, hey, just a reminder, folks, I'm available here. If anybody's struggling, I'm available. Or if you have concerns about a specific individual, then maybe you say, hey, Jim, let's go grab some coffee and chat a while, get them away from everybody and just and focus on them. You know, listen to them, focus on, and you've got a point later on about just asking open-ended questions. How's it going? You know, it's, like you said, Nancy, it's hard to get some of those the tough conversation skills, but open-ended questions and just being a reassuring voice and presence in the person might be all they need.
Yeah, I have a couple of other things, but I'll wait until we get to the DC water example.
Which we hope we can do.
Yeah.
Well, to follow up, Zoe, if you want to advance the slide, to follow up a little bit on what Nancy was talking about, which was recognizing your employees. And I think Nancy's talking about recognizing them probably in front of their peers and giving them an attaboy, if you would. And being very specific as to, you know, good job, Jim. You really did whatever is good. This one of the things that I stress in the workshops that I lead, particularly with boards and councils, is the recognition of staff for their efforts. And this is an example out of the Billings, Montana newspaper that I just love. Until I took this, I tell folks, until I took this job, I took the water utilities for granted, turning the water on, flushing. I took it for granted till I took this job. And now I have tremendous respect for them, for that career field. And what I love in this example, and I don't know how well you can read it on the screen, but I happen to see it in the Billings, Montana Sunday newspaper, and the Billings utility had put it in there. And they're recognizing a staff member. And what I like is the guys from facilities or buildings and ground. He's not the muckety muck. You know, most of the time the folks, it seems like from my perspective, a lot of times the folks that are getting recognition are the higher end folks. And here is an individual in building services. I'm not sure if you can read or not, but he goes on to describe his job and how he loves it. And his job includes mopping. I think it's up to 2 miles. And 2 miles of hallways and this and that. So that to me is just an excellent, maybe above and beyond level of recognition of staff for their hard work. But to me, what I love about that is it's not only the staff recognition, but it's also raising awareness of some of the staff that are out there making sure that your water's running and your toilet's flush. So I love that particular example. So yeah. I just wanted to share that with you. I continually, in the workshops I lead, I suggest folks get the information out about the great things that water utilities are doing. And if it's on your social media page, small town newspapers, whatever it is, share. That way we get more support for the profession. And in this case, the staff gets great support for their efforts. So
yeah, excellent. Love that.
Yeah.
Okay.
Yeah.
The next slide is getting into some of the specifics about resilience building. And what I want to start with is talking about the brain. So I want you to make a fist, and I want you to put your thumb in the middle like this, and then wrap your fingers over your thumb like that. Everybody just do that. And what this represents is your automatic brain. This is the limbic system. This is the primitive part of your brain that does your automatic approach, avoid behaviors. Whether you're grabbing something to get it out of the way, or you're avoiding a water spurt that's coming up, or whatever it is, it's really great that you have that automatic system so you can make those urgent decisions right away. However, we as humans have developed this cortex over that allows us to be more reflective, to slow things down, to think through what are my intentions here, what are my values, what are my goals. So we can override the urgency sometimes. Sometimes we want that. We want to be able to make a decision without having to think about it. It saves energy. It allows for the other parts of the brain to relax. You know, you don't want to have to think too hard or too slow for a very urgent situation. So it's great we have that. However, if all we do is react and be impulsive, how can that get in the way of other parts of our life? Brian, have you ever done anything impulsively that you later went, whoa, why'd I do that?
Yes, frequently.
Me too. We all do. And yet the automatic thoughts, emotions, and actions, and I should have put those in capitals. Imagine TEA, actions, because I'm a tea drinker. Think of it as TEA, thoughts, emotions, and actions that are automatic versus intentional. There's a lot of research going on about this. And some people are calling it, rather than your automatic brain, your impulsive brain, or instead of your intentional, rational brain, your smart brain. But however you do it, just think of this fist. And when you make a decision, was that urgent and automatic, or should I think this through and slow things down? So in order to be more resilient, just being aware of when you are reacting or responding intentionally. That mindful awareness alone goes miles and miles and miles. So that is kind of a framework of your skill set. Mindful awareness of our automatic brain versus our intentional brain. And we can apply that to many things. For example, sleep habits. If you are lying in bed and your brain is ruminating and you cannot sleep, there are ways to counteract that. There are mindful meditation practices, or there are neurological ways. You may want to get up and just take a walk around your kitchen island. Get some automatic bilateral movements going so that your brain isn't ruminating, it's disconnecting. So there are ways that we can also build in, getting darker at night, turning off your phone, reducing things that are stimulating. Don't drink coffee at night. Don't drink alcohol because it's going to rebound. So lots of sleep habits. The other foundational skill, communication skills, is this asking open-ended questions. So I got the opportunity to evaluate a statewide training program that California did some years ago when they were training managers across the state to be more aware of mental health challenges and how to communicate by actively listening. And that means open-ended questions, things you can't answer with yes or no. And write this down somewhere on a Post-it note or someplace. Who, what, where, when, how. Memorize that. Who, what, where, when, how. Who, what, where, when, how. Who, what, where, when, how. If you have a situation, anytime, any place, where you're trying to talk to somebody, whether it's in line at the hardware store or it's a person who's really seriously having a mental health crisis, if you can ask questions that start with who, what, where, when, how, and get that person talking, reflect back what you hear and say things like, tell me more about that, or do I have this right? Am I understanding you correctly? It can be so powerful in getting the situation to change. When you reflect back something that they say that doesn't make any sense, and they hear you say that and they think, well, wait a minute, that's not quite right. And then they embellish it or they change it and they think it through more clearly. It just is fabulous. So in evaluating these managers who went through the training program, they said, a person gave me this card that had these hints on it of the who, what, where, when, how questions and how to reflect back and how to summarize and follow up with them. I just keep that in my desk drawer. And if somebody comes in and wants to talk to me, I just pull that open. Who, what, where, when, how. And it reminds me of, well, how are things going in your life? What's happening with that situation? Who do you have that can support you in this? When are you going to take an action step? Those are the kinds of questions that gave them examples to feel more confident. And I thought, wow, that is a great outcome for a training session, to have something so simple and so powerful. So that's one of the automatic thoughts, emotions versus intentional, the mindful awareness of those, and the communication skills are the two practices I'd really highly recommend that you think about. The other is compassion. We tend to beat up on ourselves and others, and by doing some actual compassion exercises, and these can be found on the internet, just Google self-compassion. There's some really great research around this as well, as a way to rebound from things that you might otherwise punish yourself or others for. Just a way of changing that mindset. Next slide, please.
And we also have a quick question that's been submitted.
Mm-hmm.
It says, this presentation is so refreshing with the amount of hope and compassion. How can we assure people like you all make it into management positions?
I'll let you take that, Nancy. I'm almost retired. Yeah, I just
Yeah,
turned
me
60.
too, but I keep thinking, if I'm helping one person through a webinar like this, how can I say no? Well, here is what I think. I think every manager training session should include how to support others' well-being. It should be a requirement. These communication skills and mindful resilience skill sets should be absolutely part of every curriculum. So, for example, the Physician Leadership Institute at KU, this isn't a wellness program. This is leadership development. And my role is individual coaching of physicians who are going through a year-long training program of leadership skills. My part is to help them recognize when they are individually being resilient, when they help their team develop communication skills and conflict resolution skills that support them in moving forward systemically in solving problems. So that's what I would recommend, that you bring the idea of well-being and leadership resilience, organizational resilience, this shared responsibility. I have to take responsibility for my mindful resilience skill sets, but everybody else does too. We have to come at this in a systemic way as an organization, and that's through leadership and management. You have to train and practice. Very good question. Thanks for interrupting that, Zoe.
And I'm just thinking, Nancy, as a follow-up, if I'm not the leader, then say I'm mid-level or whatever, just keep bringing it up. Hey, Bob, how about this? Maybe that works. I don't know.
Well, yeah, training in the communication skills at all levels enables those rational conversations to happen, as opposed to a hierarchy where somebody down here who sees something that's, not safe, but they can't say anything because it's not their role. And the manager doesn't encourage that safe, psychologically safe communication, and then something blows up. And that person down there was like, well, I could have told you.
Happens a lot.
Make it safe to say so.
Yep.
Okay, I want to be sure that we do this next exercise. Breathing is the third foundational skill. And I want everybody, so Google box breathing, YouTube. Something will come up that can lead you through this. This exercise is so really effective. We tend to, when we're responding urgently, to pant. It's a stress reaction so that we can be in fight or flight mode. And we can do that all day. We can just pant all day and never really get a full exhale. But it's the full exhale that connects a central nerve that runs from our midbrain all the way through our body down to our gut for our gut reaction and back up to inform our brain for decision making. Without that full exhale, we're not going to connect to that parasympathetic nervous system that is the rest and relax mode. So I want to just lead you through a very simple box breathing technique. Ready? Sit up in your chair. Breathe in, 2, 3, 4, hold. Exhale, 2, 3, 4, 5, 6, 7, 8. In, 2, 3, 4, hold. Really breathe. Exhale, 2, 3, 4, 5, 6. One more time. Inhale, 2, 3, 4, hold. Exhale, 2, 3, 4, 5, 6, 7, 8. And relax. That is a great exercise to do throughout your day. When you shower, when you make your coffee, when you drive to work, when you lead your team early in the morning. Let's just do 3 breaths and just prepare for our day. So again, it makes it acceptable, not stigmatized, and awareness building, just to know that the full exhale is the most critical part of breathing. And 3 breaths can make a difference. I've mentioned living our values. Smiling and laughter, there is good research growing. You know, it's not funded like pharmaceutical research is, but the research on smiling and laughter and connectedness suggests that there is something to that in terms of our mental well-being. Being outdoors, same thing. There are ways that, and we don't understand quite how, but being outdoors and viewing nature, being a part of nature, moving our bodies rhythmically through nature, like through walking or hiking, really have an important impact on our mental well-being. And I know you've done that, Brian.
Yeah, because I'm a fish biologist, so I'm out a lot. So
Yeah, right.
I was out last night.
Okay, let's move on to the DC water example.
Yeah, and so I'm in academia, folks, and so I found just a great example of this in work, this applying this stuff, and it comes from DC Water. It's a video that I think Zoe's going to put. I don't think we tried to get it to run on the in the program, but it won't. But it's before work. It's an individual leading calisthenics of a work crew going out, and it just does everything that Nancy was talking about. You can see the smiles, you can see them outdoors. They're enjoying the day, and to me, it's getting them warmed up. When I've given this presentation one time, and one thing I shared was, a lot of us are old jocks, high school jocks. And what do we do before a football game? Well, we stretch. So this particular video is a work crew that's going out to fix, I think it says, an 8-inch main, and they're led in calisthenics. And so you can see smiling, you can see joviality. When I gave this presentation, the first time I gave this presentation at a Kansas conference, one of the comments that I received was from an individual that said, that he was aware of some work crews that did that, and they just were happier and more productive. So I don't think we're going to get the video to run, but I think Zoe was going to add it in a chat box for you guys. If you get a chance, run it. It's wonderful.
But she's showing it, but you can get the idea that they are bending. They're doing it in a circle. I mean, just imagine sitting in your chair right now. Just lean to your right, lean to your left. All these people doing this together, leaning forward, leaning back very gently. Don't compress your spine too much. All of those things really can be, face to face, smiling, just kind of challenging each other to prepare for the day. We also, you can do it a bunch of different ways, but this is kind of a toolbox talk that we're encouraging the construction industry to use. Little cards that have a mindful resilience skill set on it. For example, this one says, are you aware that laughter is good for your health? And a team leader can say, okay, everybody, it's time for a toolbox talk. Are you aware that laughter is good for your health? And then read this. Are you aware? Research shows a good hearty belly laugh helps relieve tension, boost our immune system, reduce stress, diffuse anger, strengthen relationships. Today's practice is seek something that will promote a good belly laugh. So, you may want to have a joke ready or something if that's the one you're going to use that day. But be careful not to laugh at others. So as I said earlier, you want to balance the laughter at someone's expense. Be sure to share your laughter with someone. So there's just a variety of these. We can let go of negativity. Research shows that courageous is contagious. Learning to let go of the past, we create space for the present. So having something where you start a team launch, where you're going on to a project together, just knowing that you're there together for a reason and that you want to start it on a positive note. So just another way of doing that.
Thanks for finding that, Zoe, and showing it, and go on to the next slide. So Nancy, we're at 50 minutes in.
Yeah.
So
the next ones are quick. So creating a crisis response plan. It's sort of like having that card in your desk with the open-ended questions, who, what, where, when, how, reflecting back to the person, having that protocol in place, having the EAP number or 988, or however you want to train your people to respond to mental health emergencies. Have a little card that they all can have right there in their pocket, on their desk, in their truck, whatever works. Connecting to local mental health professionals. Have a plan. If somebody is on the work site and you need to exercise, your reasonable suspicion for safety reasons, what's the protocol? Who do you call? What do you do? And communicate that plan to everybody. Next slide.
is this me, the butt slide?
Yes.
Oh, good. Hey, I just wanted to share that. Sorry, I wanted to share this with you. So I've had a colleague. I never have been placed in a situation where I had to do what Nancy was just talking about, but I wanted to share briefly with you a colleague here. It's a young professor, younger professor, has had university environment, young kids, younger students, whatever. She's had 2 individuals come in that were suicidal, and she had developed this particular professor. She's our HR specialist, does our HR training. So she developed a good enough rapport with those students that they trusted her, and so they appeared to be, from the way she describes it, I think they came in to say goodbye, and she could tell what was up. And and what she did, because of her training and her expertise, she used the plan. She knew who to call, and she called the appropriate people. We've got the staff network here on campus, but I wanted to share with you is to listen and trust your instinct. Well, she shared with me that one of those students that came in, she was real concerned about whether the student was actually going to commit suicide, and so she called the number she's supposed to provide, the counseling number, and they said, yeah, student needs to be seen. The next opening is in like 10 days or a week or whatever, and instead that trust your gut was my talking point or thinking point, because she knew, she stayed on the line. She said, no, the student needs to be seen now. Eventually she got to the point where the counseling center agreed and said, hey, yeah, walk the student over, because this is very, very critical. And so, like Nancy was talking about, there are resources. 988, I think, is the suicide number. But if you don't have that, call 911, because your police, your fire, unfortunately, they're probably exposed to this frequently. And so
many are trained to handle it well.
Yeah, because they're at least trained in it, whereas a lot of us don't have that training and don't feel bad doing that. Don't feel bad. Follow your gut and feel good for doing that.
It's better to potentially save a life than to regret having not done anything. And if the person does go ahead with their plan, which does happen, know that you did what you could, or you didn't know. Sometimes we don't know that's not how we interpret someone's response, and don't have compassion for yourself if that happens. Okay, the next 2 slides are resources. I'm not going to go through them, but I wanted to add one that I think could be good for this group. It's called the Job Accommodation Network, and the website is askjan.org, I think, or net. Just Google Job Accommodation Network. and it gives great ideas for ways of helping people on the job who are struggling with mental health crises or mental health challenges, so earlier in the process. The Mindful Momentum is the website for my partner and I for more information on peer support training. And then just to close, thank you again for all of you attending today, for your interest in this. Mental health really is all of our responsibility. It is something that we all can make a difference at. We can use the resources more wisely, and together we can just make a really big difference. So thank you for having me on today, Brian.
Yeah, thank you. It's been a treat. So, and we have a little bit of time for questions, I think. But if not, this has been, hopefully it's been fun for me. So.
We're just about at time, so we understand if people have to log off. If you are logging off, we ask that you fill out the evaluation form, but we are going to try to squeeze in a quick question or two if there's any. So we do have one question. It's coming from someone that's the chief operator at their plant, so the manager ranks higher than them. They say that their manager is very stressed and it's drawing down the other employees, the way his attitude is. And he's asking for help with this manager that has a tough guy attitude. He's not sure how to solve the situation because he's taken some of the manager's responsibilities, but that hasn't helped. And it's hard to approach someone who's ranked above you in the workplace.
Absolutely. So that might be an opportunity where you could use the employee assistance program. Often those programs have manager training kinds of free offerings, and you might check in with your HR person about that, because a lot of times they have to be the one to organize it, but they may be in a position to get you and that person and other managers in the same room just to talk about, to organize it as a kind of a required training. And then it's not about them, it's not targeting them, but it gives you an opportunity to talk about these things that are creating challenges.
Thanks. And any advice for small rural plants that don't have an HR?
That's the one I really want to get to.
Yeah.
And I don't know if that person can highlight more what do they need help with, if they can highlight it. But
that might be a little too specific, but I can connect you guys after the webinar.
In general, I would say that the who, what, where, when, how questions, the active listening, when that person is being a jerk or being too stressed out, and you're having to take over aspects by your being concerned about them and asking some questions about, hey, it feels like there's a lot of stress in our team. We're wanting to help you. What would be the best ways for all of us to do this, knowing that we have boundaries on our time as well? Boundary setting is a hard thing, but it's a great skill set as well. And it's something that you learn to do if you go into therapy. Well, why not learn to do these skills without having a crisis and go into therapy? So thinking about how might you set boundaries and do it in a way that's reasonable, rational, not reactive, and not, hey, doing it in a way that is emotionally regulated and reasonable and rational, and putting it back onto them. How am I supposed to do that? Is a really great how question. How am I supposed to do these jobs? How can we break this down to reduce the stress on everyone, not just you? I don't know if that's helpful, but I think the more that you can be reasonable, rational, and to set your own boundaries, the better off you will be. Other questions?
Yeah, we'll try to squeeze in one last question, which is, how can you be compassionate towards an employee where their home life or personal decisions are impacting their work performance? maybe to the point where their work performance is struggling to the point of needing disciplinary steps. So how do you find that balance? You know something bad's going on at home, but you still want to adhere to your employee policies.
Right. Well, sometimes it's just making sure that that person knows that if their home life interferes too much, there are disciplinary actions that are a next step. Sometimes people don't know that, but letting them know that at some point that might be a possibility, but there are steps they could take in between. And doing a warm transfer, like saying, before we get there, you might want to consider reaching out to our employee assistance program. How about if we make a call to them right now? Let me connect you with them. I'll step out of the room so you can talk with them. Would that be helpful right now? Would you be willing to do that? So warm transfers are a really great way, also to that 988 line. And a person doesn't have to be actively making suicide threats in order to benefit from the 988 call. It's another great resource in general that you can use.
Gotcha, thank you. And we'll wrap up there for today. A huge thank you to Brian and Nancy for sharing their expertise with us today. Following this webinar, you will receive a follow-up email with the slides from today and a link to the recording. We also ask that you complete the webinar evaluation following the webinar, so you can let us know your thoughts on today's session, as this helps us plan future webinars on topics important to you. Thank you again, everyone. Oh, sorry.
I'm sorry to interrupt, but I did want to say that our contact information is on the very last slide. Oh. So if you receive these slides and you want to get in touch, link in, reach out, we're here to help.
Great. And those slides are included in the follow-up email, so people will have that contact information afterwards as well. Thanks, everyone. We hope to see you at future EFCN events, and have a great day.
Thanks so much.
Thanks.